Sorry if my Jesse irritates you, but it is what it is. I'm still celebrating the triumph that we had over Manchester City, and the fact that we are still the reigning champions. Or if you will forgive me, it is what it is. There's nothing you can do about it. My name is Abdul, and welcome to the Travelness YouTube channel. Today we are going to look at some practical questions for the new test of competence CBT, to be specific. As I indicated in my last video, these are questions that were put out there by NMC UK and Alpha Plus. Alpha Plus is the organization that collaborated with NMC UK to set these new questions. So we are going to look at both parts, the part A and part B. I made mention that the new CBT comes in two parts. We have part A and part B. Part A being the numeracy part that contains 15 questions for 30 minutes. Then we have part B, that is the clinical part of the theory, which consists of 100 questions, and you have 2.5 hours to answer those questions. Of course, they are multiple choice. So we're going to have a look at some sample questions. These are practical questions, as I said. NMC UK didn't go out of the usual domains, but they've re-strategized it to 7 main components. Still talking about leadership, still talking about the NMC code of practice, still talking about drug calculation, medication or drug administration is still captured in there. And this time around, they give nurses a bit more edge, where there is a little bit of interpretation of lab results, and there is input and input outtake or measurement. There is also issues pertaining to examination, i.e. inspection, palpation, auscultation. All these things have been chipped in, they have been factored in, so it gives the nurse more independence. However, the questions, I must say, are not difficult as people were panicking about. They are normal questions, and to me they seem much more easier than the current ones that we have. And there are a lot of changes. One good thing about this test is that you now have access to a calculator while doing the test. Here the calculator is on screen. It's on the screen, so where you think you need a bit of calculation, you just click on it, it comes, then you key in your figures, you get your answer, then there you go. It's as easy as that. I said the fee remains at £83, and when it happens that you fill the first part and you want to resit for that, then you pay £50 for that. And when you fill the part B, which is the 100 questions, and you only sit for that, and that is also £70. So with this, if you don't get the required score, you don't sit for the whole exam, but you only rewrite the parts that you didn't pass. So that is it. Without wasting much time, let's start with the numeracy. So for the CBT, that is the new CBT test of competence, the computer-based part A, the numeracy part. This is the content of it. These are the areas that the questions will be set from. So one, there are certain questions from measuring correct dose. So you'll be given a pictorial evidence, and you do the measurement yourself, and you apply and analyze, and the total number of questions coming from that aspect is 2. You have metric units. So you do a lot of conventions over there, from milliliters to liters to liter, from liters to milliliters, from milligrams to micrograms, from micrograms to milligram, and so on and so forth. You have 2 questions from there as well. You have oral medications. Oral medications, they can be tablets, There can be suspensions. Yeah, you do the conversion and know the amount to or the quantity to give, and you have 4 questions from there. Then you have injections. Yes, you have injections where some of them you need to calculate the injection or milligram to give per weight. That is the weight of the patient. So most of them are just straightforward multiplications that you'll be doing, and you have 3 questions coming from there. Then you have intravenous infusions IV. So most of them this can be whether normal saline, or it can be dextrose solutions. It can be whole blood transfusions. You have questions from there. You calculate the amount to give. Some you calculate just the flow rate. Yes, the flow rate of the IV infusion. Then you have 3 questions from there. Then we have fluid balance, so intake and output, where you are giving the amount taken, quantity taken in by the patient, and the one expelled by the patient through urine or what have you. So you measure that. You have 1 question from there. So in total, you have 15 questions coming from this discipline. So it's very easy, and you have 15 question for 30 minutes, and each question carry a marks. Yeah, let's go and have a look at the practical questions. So this will be the appearance of the screen for the CBT test. That is the numeracy part A. Yeah, so on the top left corner you could see the calculator. This is on screen. When you click on that, there'll be a pop-up window where you make your input, tabulate your results, then finally type in the answer. When you look at the top right corner, that is the timer. So you see the time remaining. Now you have 29 minutes 32 seconds, and below it you can see it the numbering, question numbering. So you have 1 out of 15. As I said, the part A is 15 questions for 30 minutes. Then beneath that you will see the flag for review. This flag for review button serves as an avenue for you to reserve questions so you can attend to them later. For instance, if you provide an answer that does not sit down well with you, or probably you tend not to get a better understanding of the question, you just flag it. It will save that question for later, so that after the exam just all the questions that you flag will now appear for you to review them or go through them to come out with a decisive answer. So question 1 is saying, what is the volume that has been drawn up into the syringe? Please use the correct unit and write your answer to 1 decimal place. So looking at the syringe or the picture provided, the blue shaded part is the liquid drawn. So you can see that this is like 6.5 mils. You have to be mindful of the unit measurement. Yeah, so the box provided below is where you type your answer. So you just type 6.5 mils, as simple as that. Question 2 is saying, what is the volume that has been dispensed? So this is talking about drug administration. Please use the correct unit. So looking at the pot, you could see the granulation is on 20. So this is 20 mils. As easy as that. You just type in your answer. Question 3 is saying, a patient has been prescribed 2 liters of 0.9% sodium chloride, or what you term as normal saline. What is the volume in milliliters? So this is just conversion. So this is just conversion. So 1 liter is going to is equal to 1,000 milliliters. So this is just 2,000 milliliters. As simple as that. This is just straightforward. So this is a typical example of how the calculator will come up when you click on it. So it's just on screen. As I said, you make your input, tabulate your results, then type in the answer. This question is saying, a patient has been prescribed 0.6 gram of ibuprofen. What is the dose in milligram? This is just conversion. So they are just straight away. Now you can relax and not panic much. So you just convert and write the answer. A patient has been prescribed 300 milligram of phenytoin. How many tablets should be administered? drug administration. This is simple calculation, and this, you see, you can see that this, they give you pictorial presentation, making it so easy for you to assimilate and understand the question. So the phenytoin tablet, what you have in stock is 100 milligram tablets, and the patient has been prescribed 300. So you're just giving 3 tablets. It's what you want over what you have. So it's 300 over 100 is 300. Simple as that. As I indicated, irrespective of your discipline, the numeracy part A, you're going to have the same number of questions. That is 15 questions. Yeah, that is 15 questions. And sometimes the name of the medication will be changed to, or will be tailored to suit the discipline that you are writing for. So be it mental nursing, be it midwifery, be it general nursing, or adult nursing, or children's nursing. So phenytoin, this is a typical anti-epileptic drug or anti-seizure drug. This can be used in mental nursing. This is used in general or adult nursing as well. The next question is saying a patient has been prescribed 1 gram of carbocysteine solution. What volume should be administered? Please use the correct unit. So carbocysteine solution, what you have is 200 milligram per 5 ml. So just do the calculation and write. They are just straightforward. This is saying a patient has been prescribed 100 milligram of phenytoin suspension. What volume should be administered? Please use the correct unit. So it's phenytoin suspension, what you have in stock is 250 milligram per 5 ml. You just do the calculation what you want. That is the desired dose, 100 over stock dose, that is 250 times 5. Then you provide the answer. A patient has been prescribed levetiracetam suspension at a dose of 10 milligram per kg. Your patient weighs 70 kg. What volume should be administered? Please use the correct unit. As simple as that. Just look at it. What you desire over what you have, you just do the conversion. A patient has been prescribed 60 milligram of flupentazole decanoate. What volume should be drawn up for the injection? Please use the correct unit. This is a typical RMN question or mental nursing question because this particular drug is an antipsychotic drug, but it doesn't matter the name of the drug. It's just the conversion. Just get your conversion right and just type in. A patient has been prescribed 4 milligram of diamorphine hydrochloride. What volume should be drawn up for the injection? Please use the correct unit and write your answer to 1 decimal place. Just do the conversion. As I said, these are Yes, so a patient has been prescribed 0.2 milligram of the chosen. What is the dose in micrograms? Again, so you can see they are just conversion questions for the numeracy test. Very straightforward. You need to take your conversion, unit conversion very, very serious, because it's always like that. It's always like that. So now from milligram to micrograms, and from micrograms to milligrams, as simple as that. A patient produces 1,250 moles of urine in 24 hours. What is the volume in liters? So this is just input and output measurement from milliliters to liters, from liters to milliliters. It's very straightforward. As you saw with the numeracy, it's very easy, it's very simple. 15 questions for 30 minutes. You have enough time to just kill it once and for all. There's calculator. You saw where you could flag it if you're not too sure of the answer. You flag it so that after the exam you can review your answer. And you saw the calculations, just the drug administration and giving a particular stock, and this is what you have in stock, this is what you have to administer. So they are straightforward. These questions are the same for RMN, for midwives, for general nurses, for learning disability, and for children's nurse. The only difference is that sometimes the name of the drugs will be changed to suit your particular field. So you'll be seeing Petidine, you'll be seeing cefuroxime, ceftriaxone, for general side. You've seen amitriptyline and other medications that are used in psychiatry or mental health. You see them. So when it gets to the drugs, then that's where they use drugs pertaining to your field. So 90% are generic, which means it cuts across all fields, and 10% are your field specified. Okay, so it makes it easy. Okay, so these questions, 90% of them are generic. Yeah, it cuts across all fields. It's only 10% that is tailored towards your specialty. So that is it for the part A. Yeah, so for the part B, which I said is the clinical or the theory, this consists of 100 questions, and you are to use 2.5 hours to answer these questions. These questions cut across, talk about the NMC code of practice, talked about duty of conduct, talks about transparency, captures all aspects of the principles of nursing ethics, and it also talks about leadership. It talks about applications, talk about diagnoses and those kind of stuff. So let's have a quick look at that. That again is generic. 90% of it is generic, so it's fine. Let's have a look at some of the practical questions. Yeah, so with the part B, that is the clinical part B, for the CBT as I indicated, this consists of 100 questions for 100 multiple choice questions for 2.5 hours. Yes, that will be enough for you to answer these questions, and it comes in 7 different platforms. There are 7 different platforms that NMC UK will be picking the questions from, or setting the questions from, irrespective of the discipline, whether you are writing for adult nursing or children's nursing or learning disability or mental nursing is the same. So platform 1, being an accountable professional. So questions relating to work ethics will be asked, and about accountability. So you can have 6 questions from that side, and or 5 from evaluate and create. The platform 2 is talking about promoting health and preventing illnesses. So just about health promotion, suicide prevention for psychiatry, health education, and the infection prevention control. These questions will be set from this angle. Then platform 3 is assessing needs and planning care. So questions surrounding care planning for midwives. Here you'll be having questions on assessing women in labor or assessment of the newborn, so these questions coming from these areas. Platform 4, providing and evaluating care. So it's just simple measuring of input and output, the infusions that you give, the end result of the care that you give, and the care you provide to your patients. Platform 5, leading and managing nursing care and working in a team. So this has to do with leadership. Leadership questions will come from the leadership aspect. So you have a total number of 10 questions coming from that side. Then improving safety and quality of care, going by the NMC UK principles or code of ethics. Questions will come from there as well. So all these have been coming already, just that they've reframed or restructured the various platforms that they set their questions from. Platform 7, you're talking about coordinating care. So designating duties, assigning roles, and you have about 10 questions coming from there. You have Annex A and Annex B having 7 questions. So these questions can be general, coming from all angles. So these are the parameters that now the new CBT part B, which is the clinical part, will be set from. So in total you have 100 questions. Let's look at the practical questions set from these sections. That is part B of the CBT. Again, that is how it appears. You have your objective and calculator as well. You might need it. Objective tells you the rationale behind the question or the platform that the question has been set from. You can also use look at the top right corner. You can see the timing. As I said, you have 2.5 hours for this, so you can see 74 minutes 40 seconds, and this is question 1 out of 50. I said you are going to answer 100 questions. This is question 1 out of 50. You can flag for review as well. So if you're not sure of the answer, you just flag it and you attend to it later. So question 1 is saying, which of the following describes a quantitative method of research? Choose the correct answer. So multiple choice. You have reviewing published research, exploring a phenomenon by interviewing participants, collating people's views and opinion, collection of numerical data. You choose that, you are gone. It's just simple. Then question 2 is saying, choose the 4 themes of NMC's the code. Choose the correct answer. A, prioritize staff, practice safely, preserve well-being, promote health. B is saying prioritize people, practice effectively, preserve safety, promote professionalism and trust. Then C is saying prioritize people, practice with pride, preserve health, promote the NHS. D is saying prioritize patients, practice within your limits, preserve others, and promote well-being. So you see, these are even repeated questions from the old CBT. So these are not new to say. So you just have to continue reading the material. So just the answer is B. As I said, I'm just giving an overview of how the questions will look like. Probably we'll have another video where we'll solve all the questions and provide you with the answers. These are practical questions that will be coming. Yes. Question 3 is saying, when caring for a patient who is a Jehovah's Witness, suffering a severe hemorrhage, what do you consider? Choose the correct answer. He said they are not able to be resuscitated. B, they are not to receive blood or blood products. C, they are not to be sedated. D, they are to be cared for by professionals who are GW. So you can just see it's simple. We all know Jehovah's Witness do not receive blood or blood product. So you just know all these things. They are just straightforward. This question is saying, when caring for a patient who does not speak English, how do you obtain information from patients? Choose the correct answer. A, find the information you need from the medical notes. B, ask a family member to translate. C, ask the patient to draw pictures. D, use a face-to-face or online translator. Look at the suitable answer, then you choose. When a drug error occurs and the patient has been assessed for any harm, what is the next priority? Choose the correct answer. A, continue your drug round. B, inform the patient of what has happened. C, continue to administer the next dose. C, call the patient family. It is important you make the patient aware of what has happened. You should let them be aware. You should know what has happened. So these are just straightforward questions. This is saying the HPV, that is a human papillomavirus vaccination preventatory disease. Choose the correct answer. So you can see it cuts across from obs and gynae, from midwifery, adult nursing. It's just there. Testicular cancer, ovarian cancer, cervical cancer, and bowel cancer. It's just there. Cervical cancer. You can see these are straightforward answers. These are they are not difficult. Which of the following professions are specifically trained in smoking cessation? Choose the correct answer. Chiropractor, the pharmacist, the hypnotherapist, and the dietitian. It's just simple. Which of the following diseases is notifiable to Public Health England? Choose the correct answer. Clostridium difficile, the mumps, influenza, human papillomavirus. So use the Royal Medicines book, read the NMC code of conduct, the OTBT materials, still go through them, because these are all questions that have been tackled in that part. So they are just simple. Which of the following is a health visitor's responsibility? Choose the correct answer. Supporting the physical and emotional growth of a child, administering immunizations, giving emergency aid and treatment in a crisis, assessing speech and language development. These are very, very simple. They give emergency services. Yes, they do. So the questions, they are likely answers. So you look at for the most suitable ones. Okay, you look at most suitable option, then you choose. It's saying, what are the common complications of uncontrolled blood sugar levels in diabetic patients? Choose the correct answer. A, retinopathy, peripheral vascular disease, renal failure, joint pain, urinary incontinence, retinopathy, memory loss, joint pain, peripheral vascular disease, irritable bowel, liver failure. So this is talking about complications of diabetes. So just look, they are just straightforward. These are just straightforward questions. A doctor requests a lactate test to be taken from a very unwell patient. What type of sample is taken? Choose the correct answer. Full blood count, urine sample, stool sample, blood gas. Simple questions. Scale 2 on the News 2 chart is used for which group of patients, or which patient group? Choose your correct answer. Carbon dioxide detaining patient, those receiving intravenous therapy, those with urinary catheter, those who have been exposed to carbon monoxide. Scale 2, the person is on supplementary oxygen. So these are just simple, straightforward. Which patient with chronic pain conditions are screened for which of the following? Choose the correct answer. Chronic pain condition: low mood and depression, coronary heart disease, bowel cancer, schizophrenia. chronic pain conditions. So look at it. Very simple, very, very simple and straightforward. Which of the following groups has the highest rate of suicide? Choose the correct answer. So you could see the questions cut across from midwifery, from a bit of mental nursing, a bit of children nursing, you know. So even when you are writing or sitting for the adult nursing, you have bits and pieces of all these. But most of the questions, now they are saying only 9% of those questions will be discipline specific. You see, so like more than 80% is general, is like cut across all fields. Just a few percentage of the questions will now be based on your specialty. Yeah. So this is highest rate of suicide: children under 18, women, men, elderly over 75. So this one there is women. Sorry, it's women. A patient present with a productive cough, low saturation, high respiration rate, raised lactate with news 2 score of 9. Which of the following does this indicate? Choose the correct answer. So simple, just giving you, as I said, giving the nurse more independence for you to even recommend or make a provisional diagnosis. So there's productive cough, low saturation, high respiration rate, raised lactate. Come on, it's not bowel obstruction. Chest deep vein thrombosis, chest sepsis. So there's a chest infection, there's sepsis there. New 2 score more than 5, now 9. So it's just straightforward, man. It's straightforward. It's just straightforward. Yeah, the same question. Bowel obstruction, chest sepsis, deep vein thrombosis, myocardial infarction. It's just chest. It's just chest. Prior to surgery, how long are oral fluids withheld? So for how long would the patient be on nail pills? It's saying choose the correct answer. 30 minutes, 2 hours, 4 hours, 6 hours. Simple. Just choose your answer. What group of drugs are used in patient-controlled analgesia? So choose the correct answer. Steroids, NSAIDs, non-steroidal anti-inflammatory drugs, paracetamol, opioids. Come on. Do I need to tell you this? No, it's just simple. Patients who are put on furosemide are warned of common side effects. Choose the correct answer. So diarrhea, oliguria, constipation, and polyuria. So furosemide, that's lasis. So that is diuretic. So take what is the side effect. This is very, very, very straightforward. Just choose your answer. Your patients are. You have a patient who is choking. You have administered 5 back slaps with no success. What is the next step? Choose the correct answer. Give 5 abdominal thrusts. Give 5 more back slaps. Start basic life support. Monitor the patient. Choking. This is ILS. That is immediate life support. Some say you can be treated in basic life support as well. So this is just straightforward questions. What is the responsibility of an occupational therapist? Choose the correct answer. OT. So assessing someone's ability to see, assessing injury or damage in a patient, supporting people whose health may prevent them from completing their normal activity, reviewing and adjusting prescribed medication. So this question is C. Very straightforward. Whose role is it to lobby the government to support nurses and make positive change to the profession and working conditions? Choose the correct answer. A, the individual team of nurses. B, chief executive of the trust. C, the human resource department. The last one is the nursing union. So do I need to tell you this? No. So this is just straightforward. You choose the answers. So these are some practical questions. I just decided to give you an overview of how they look. If you want more practical questions, kindly visit Pearson VUE, the Pearson VUE website. There are a lot of practical questions that you can practice with, depending on your discipline, whether you are writing for midwifery, writing for mental nurse or adult nurse or children nursing. So you practice more. When you visit the NMC UK website as well, you are going to get a lot of PDFs and videos on their webinars they organize for you to read more until I bring the next videos on the ones that I've solved for you. Yeah, so welcome back. Now you've seen the question. I hope your anxiety have been allayed. I think the panicking has subsided now. You see, there's no much changes. These questions are familiar. I intentionally didn't answer most of them because I wanted you to have a feel of what to expect. I'm going to do a special video, and in this video I'm going to answer all questions. I'm going to provide answers to all those questions that we saw today, and even more. I'm going to answer close to 100 questions for those who are sitting for the will be sitting for the CBT, so that they will be practicing. Again, I'm going to make a special video on the OSCE. I think I haven't made any video on OSCE, and there have been lots of questions. Now that there is a new OSCE rolling out, I'm going to make a video especially on that, what is expected of you, the marking scheme, you know, what you have to do with your care plans, and yeah, we're going to look at that. Thank you very much for watching. If it is your first time watching, please subscribe, share with your colleague. If you've been with us since day one, thank you very much. Thank you for the support, thank you for the love shown. Hoping to see all of you here soon. Bye.